The Department of Public Health and Social Services has announced that due to budget reductions, the Division of Senior Citizens has suspended transportation services to its 12 senior citizen centers on Mondays for the weeks with no holidays. Public Health Director James Gillen says this all started when their budget was passed in late September. He argues his agency had no input during the budget hearings, and this is the end result.
We basically wound up with about $3.2 million less than what we had asked for. And then the contractual component, which affects the senior citizen services, it was around $2 million less than what we had asked.
Gillen says after the reality set in about their budget reductions, he asked the Senior Citizens Division staff to save funds, and that resulted in transportation services and other cuts that took effect on October 31st.
We had to limit transport to the senior citizen centers to 4 days a week rather than 5. We had to put some caps on our feeding programs. We have congregate meals at the senior centers, and plus we have home-delivered meals for seniors who can't get to the centers and have a need.
In total, Gillen says they cut $800,000 in programs. This includes elderly nutrition program meals capped at $802 for congregate and $1,290 for home deliveries, monthly food commodities, field trips, and other activities. In addition, non-fixed route transportation services are limited to medical services. But Gillen notes they only have enough to meet the Manamco's basic needs.
We think that most of our seniors who are going to the centers will be able to find transport to the centers. It's a little inconvenient, but some of the services really, they were nice to have, but really not all that necessary.
Ben Lozano and many of the Manamco at the Senior Citizen Center in Sinahaña feel they deserve better and disagree with the recent service cuts. Lozano says he feels bad and wonders if there is enough federal funds to help out.
We're on our last days of our life, and yet the services is going to be reduced. We don't have much life left over, and then we are going to suffer for not having good service.
Lydia Mostratis also doesn't like what's going on and questions why medical transportation services are not cut because she believes it's the responsibility of the family to drive their senior citizens to medical appointments and not the senior division.
So why they cut the program when they give the service to the one with dialysis? At least the family is responsible for that, not the senior center.
Surprised by the cuts, Benny Campos Jr. thinks not one day of services in the week should be reduced for the Manamco. He argues they deserve to maximize whatever time they have left with each other.
The Manamco deserve every day on the center for their pastime to, play bingos, be happy, away from home, stressed out, remove the stress and all that. Yeah.
So this just makes you stressed out?
Of course.
Sources also tell PNC that while transportation is the first to be cut, 4-day work weeks could soon be a reality for those contracted with public health. Gillen feels the sentiment right now is that everyone has to share in these tough times and shares his final thoughts on the situation.
I think if the money's not there, it's not there. And I don't think we should be asking for any more. I don't think we've really, anybody who's going to be affected by some of these cuts, it really is not going to affect the quality of their lifestyle.
Governor's Office Communications Director Troy Torres also says that these are valid concerns, but notes it was expected when public health's budget was reduced.
This should come as no surprise to the Budget Committee or the Budget Chair that because they reduced their budget by $3.2 million, public health doesn't have a choice but to start cutting and prioritizing services. And it's really a sad reality, but it's not something, if this were the 15% reserve, we could just easily restore the funding amount, but this is not a 15% reserve. This is much more harsh. This is an actual budget cut that would require the legislature to reprioritize and reprogram money if they want to save these programs.